Hi, everyone, and welcome in again to Conversations with Dr. Charles Ackle. My name is Pat Bryant, and I work with the Emmy brand. Have you heard anything about the rising cases of cancer among the younger population? It's very concerning, and we're sure you're concerned about it. And that's what we're going to talk about today with Dr. Charles. If you've not met Dr. Charles Ackle before, he's the gentleman here on the split screen today. Charles is the chief medical officer here at Emmy, and he's a fellow of the Royal College of Surgeons in London. He also trained in medicine at Guy's Hospital in London and has spent decades researching into transplantation and immunology, which, Charles, that sparked a passion years ago that continues to burn very brightly today. So welcome in today. I'm excited about today's subject.
Thank you, Pat. Always a pleasure to have a chat and hope to educate each other because I learn as much out of these sessions, I think, as I hope I teach. So
That's
that's always
great.
good.
Well, the teaching is wonderful. And today when you brought this up as a subject that we might talk about, um, I think everyone who heard about this was immediately concerned. And you don't really have to read very far and do searches to find really valid information of exactly what you've talked about, that there is some rising incidence. Anytime I think you have a rising incidence of a disease that we think of as being an older person's disease, when you see that show up in younger populations, everyone's ears kind of perk. So, Dr. Charles, give us a feel for what is this recent rise? What are you hearing and reading and getting involved in that would help us understand how this is a growing concern?
Well, I've been involved in cancer all my professional life. I was one of the first people, just to show how old I am, to start doing colonoscopies and things way back in the 70s.
Wow.
And screening and what have you. And we used to see the standard age range for colorectal cancer, which is where I really want to concentrate, used to be something like 60 to 75 years of age. That was the main group of patients we used to see. Now, occasionally we'd see a 40, 50-year-old, and that would be really unusual. But what that would signal is that that patient had almost certainly a genetic form, a hereditary form of
Yes.
cancer. And that used to be called familial adenomatous polyposis coli, FAPC.
So
And
that was, hey, they found polyps in my parents, and so therefore at 45 or 50, I need to begin getting colonoscopy.
even before, so the whole point about familial polyposis is these polyps appear at, just after puberty.
Ah,
In fact, now you can check the gene. It becomes a lot easier. So if somebody's got FAPC, you get the genetic profiling of the kid. In the old days, we'd have to wait until the children became pubertal, and then we'd monitor them, and then they'd suddenly produce not one, not two, but thousands of polyps. And that was part of the basis for the so-called polyp cancer sequence, which we also saw in older patients, where we were pretty sure that many, not all, but many cancers developed originally as a polyp and then turned malignant after a period of time, probably after exposure to the wrong kind of microbiome. That's also becoming clear that there are certain bacterial invasions of these tumors that seem to enhance the malignant change. So FAPC was what we pick it up, say, yeah, okay, fine, let's get the genetic. But now every generation from the last 3, 4 generations, Gen Z, Gen X, baby boomers, and I think it's the baby boomers that are the main problem. We're seeing an increase generation by generation of this colorectal cancers, and they are advanced. They're presenting late. They don't present. The beauty of colorectal cancer is if you catch it at its earliest stage, you've got something like a 95% cure. You can cure it. It's brilliant. But if it gets to the stage where it's already spread, stage 4, then the cure rate is way down, and you need all sorts of things from chemotherapy and now immunotherapy, etc. And
yes.
it's still not great. So you want to catch these things way early when you can deal with them surgically,
But
and the
if
results are great.
but if classically we were screening at, let's just say, 45 years of age, and now it's occurring earlier,
There you
What
go.
is it that's presenting? What types of
Well, well,
symptoms?
there's the cause. Well, the good news immediately is to say, again, this is hot off the press, breaking news, is that you would have expected that everybody should have a colonoscopy. And what we used to teach was, look, there is a familial incidence of colorectal cancer, and if you've got a family member, a
Mm,
first degree family, father, mother, brother, sister, who has developed colorectal cancer, you start screening 15 years younger than the age they presented. So if they presented at 60, you start screening 15 years earlier. If they
okay,
present
good
at
rule of thumb.
50, you go, yeah, and it was a good rule of thumb to screen the younger members. But now we're seeing these late presentations, and if they're presenting the age of 50, really we should be looking at least 15, 20 years earlier, which means we
Wow,
should start colonoscoping 30-year-olds, right?
wow,
And that's, I mean, it's huge pressure on everybody. The good news, as I said, is that there is now a blood test which has something like an 85% accuracy in diagnosing colorectal cancer. It works by looking for circulating tumor cells and circulating tumor DNA. This is really new. It still hasn't been validated. But if you can check it out with a simple blood test and you add that to the routine screening at 20, 30 years of age, well, then we've got a chance of picking these guys up really early. And if we can pick them up early, we can cure them.
Charles,
Now,
do you consider an 85% identification rate to be good, adequate? How would you frame that?
well, at least it's better than 50%, right?
Yeah, right.
It's not perfect, and we'd like to see a much higher rate. But on the other hand, the downside is, what is the risk of having what we would call a false positive? And the answer is that probably that patient would undergo a colonoscopy. Risk of colonoscopy is not that high. It
Right.
would be great reassurance. And I think that accuracy will improve as more studies and time and better engineering of the genetics takes place. So I'm really watching that, and I think that's really quite exciting. So at least we've got a step now. But the problem is, surely prevention's better than cure, right? Who wants the damn thing in the first place? So on the one hand, the people with genetic tendency who've inherited this, there's not a lot you can do about it, because the chances are that it looks at the moment in our present state of knowledge, you're going to get it. It's an
Right.
autosomal dominant.
Unlucky gene club.
It's an unlucky gene club. Half the kids are gonna carry the gene, and then you've got a problem. That's the truly inherited, and those numbers should be small. But what we're dealing with today is epigenetics, which is really mutational change in the DNA sequence as a result of external influences.
Okay.
So classic case would be lung cancer and smoking, right?
Okay.
So you may have a hereditary tendency to get lung cancer, can't do much about it. On the other hand, if you're a heavy smoker, even though you don't inherit a gene to get lung cancer, the genetic makeup is damaged. The genetic engineering that takes place becomes damaged, and this is called an epigenetic change. You then can develop the cancer, but that's something that is, if you like,
so those are more behavioral external
exactly.
factors. Yes.
Yeah. So we need to look and see, well, is there what are the factors that might be influencing this? And there's a whole bunch of studies out there, and there are a number of usual suspects, shall we say, who are high. And the classic ones are anything that induces a chronic inflammatory process, particularly if it's in the bowel, right? But any chronic inflammation, we've had this conversation before. Acute inflammation, good. Chronic inflammation, bad idea. And so things that induce a state of chronic inflammation are things like obesity, diabetes, high lipid levels, low exercise, you're not doing any exercise, sitting around, too much alcohol. The secret with alcohol, by the way, is to make sure that you choose your doctor, that the doctor you choose to look after you drinks more alcohol than you do, and then there's not a problem, right? Because that's how you gauge the level. Because it changes every 5 minutes. So anyway, and then there's something really interesting that came up just the other day, And that is that if you are a cesarean section baby, right, and especially if you're a female, um, a girl cesarean born, you have a slightly higher incidence of getting colorectal cancer and one of these early onset things, which is very interesting. And it begs the question of, well, is it, the additional thing we know is that the microbiome, an abnormal microbiome, is almost certainly a factor. Now,
Okay.
those two things are interesting because when you have a cesarean section, the baby does not necessarily get the bugs from the mother.
Right.
Particularly if the mother doesn't have the bugs in the first place, right? But in the normal, healthy person who's got good bugs, the mother transmits the bugs to the baby because by passing through the birth canal, the baby is contaminated, shall we
Yes.
say.
Yes.
For years, the French midwives have been very smart. When they do a cesarean section and they've sewed it up, they take a bit of poo from the mother and they smear it on the baby.
Wow.
And you think, well, that's disgusting. Why would they do that? In fact, they were probably doing exactly the right thing. They were colonizing the baby with the mother's.
It's almost like they're trying to birth their microbiome also.
Yes, and that's why the birth canal is actually very close to the fecal, outlet canal, your anus. I mean, why would the two things be so close?
That's
There is
amazing.
a reason for that. So the microbiome rears its head again as being a terribly important factor, and it may well be that the modern generation of kids, we've had again this conversation where we've seen the incidence of inflammatory diseases, particularly asthma, diabetes, mental health disorders. They've rocketed in the last 100 years, or certainly the last 50 years. And we're now seeing this cancer increase, and as I say, mental degenerative diseases, Alzheimer's and Parkinson's. And some of that's got to do with the fact that our microbiome has become less diverse. We don't have 40,000 different bugs in our microbiome. We've just got a few hundred or thousands. We're just not looking after ourselves. Our diet is probably a factor, and all these other things that I listed. And by the way, one of the things they say, well, isn't it just that we're diagnosing these guys earlier, these poor people with the early? No, because this is a global phenomenon. And if there was an increase in diagnosis, we should be seeing that in the older folk as well.
Sure.
And the problem is that the young people are presenting late. They're presenting with advanced disease because we're not picking them up early enough to save them.
Which is really a fearsome thing. When you consider in your youth, that should be your most vibrant time where your body is almost, super powered and not susceptible to those types of things. But, to the point you made earlier about obesity and diabetes and lack of activity, we're seeing those things now. They're tending to be almost epidemic in our modern societies, where it's ultra processed foods that are being consumed, which makes people obese at a younger age, and they're not getting as much activity because they're doing this as opposed to doing this. And you see the result, right?
And stress, the fact that there is stress that is not linked with physical response to it doesn't help. So we can touch on this because this will be the subject of another discussion and two others about the science we're doing and about aging. So the colorectal cancer is really a disease, and cancer generally in humans is a disease of old people. Other than the genetic ones where we see in babies or young people, generally the big bulk of cancers occurs in old age when your system is all clogged up and the chronic inflammation has caught up with you. And as I say, that's the subject of another discussion. But if you're going to have that kind of senescence, then you need to see, well, what's going on. And the hot off the press paper, which I mean, I can listen.
Flash it up. Yes.
Inhibition of IL-11 signaling extends mammalian health span. Note that, and lifespan. And this is from the journal Nature, so I'm not making it up, right?
Sure.
And IL-11 has been shown to be the major factor in terms of the aging process and cell damage, which is where the cancers and things, if you like, can come on. And IL-11 is part of the IL-6 pathway. IL-6 is the archetypal marker for inflammation.
Okay.
And chronic elevations of IL-6 are bad news. The IL-11 is involved in that pathway with the mammalian target of rapamycin, etc. As I say, it'll be the subject of another discussion on
Yes.
aging. What's
Longevity.
happening is we're aging. This is a measure, if you like, that we're getting old, and so old that we're now getting cancer, and all these other things follow, the Alzheimer's, Parkinson's, etc., etc.
You know, Charles, it's fascinating to me. You've talked in prior conversations that we've had about this chronic inflammation. It's not as though it sources and stays in one place. It's chronic in the bloodstream. It's moving around the body. So I'm assuming that makes us more susceptible in variety of places in our body. And so the question goes back, and I want to focus the conversation a little bit towards the end here about what you've discussed about the connection between immune health and chronic inflammation. In addition to poor diet, lack of exercise, stress and anxiety, we also don't get the same nutrient and microbiome profile that we maybe grew up with, walking on the farm barefoot and, picking up all the worms and bugs and everything else. Our parents may have gone, oh my gosh, you need to take a shower, but those things were good for us because they were honest. Explain that connection. And then, obviously we're here to talk a little bit about Emmy as well. How does something like Emmy help in that regard?
Well, I mean, you've hit it. In our previous existence as human beings, we've interacted far more closely with our environment, and this is part of this old friends hypothesis that we've talked about. And urbanization, concrete jungle, all these things have not helped. What we know quite clearly is that the immune system is the fundamental factor in terms of monitoring, repairing, reconstructing. It does just about everything. I talk about the Wolverine healing factor, right? That some of the younger people will understand. And basically, it's healing factor. It's fantastic stuff. And the gut happens to be the single biggest component of that. And the linkage of the gut with the brain is an absolute fundamental as well, something that we hadn't really appreciated. And as I keep saying, that there are at least two contacts between the brain and the gut. One is the nerves, the vagus nerve particularly, which is in computer equivalent would be your LAN contact for getting your computer
Plugged right into the wall.
Right. And then the other one is it goes through the blood and the humoral system, which is the Wi-Fi, because it's more wishy-washy and in the air out there somewhere.
Mm-hmm.
But the point is, it's a fundamental, and it's all to do and tuned by the effect of your microbiome, not just the bacteria. I talk about dark matter. There are viruses, there are yeasts, there are all sorts of things that we don't even begin to understand, bacteriophages, chemicals that are in there. But whatever it is, we know is critical in terms of getting your immune system tuned. So this is the orchestra, if you like, in the microbiome of all these different agents that have to, something has to coordinate them. And what we've learned in immunology is that you always need some kind of broker. You need an adjuvant, which is why we talk about immunoadjuvants.
Yes.
And IMI is a classic immunoadjuvant. It has this effect of being the conductor that orchestrates the orchestra, if you like, and keeps it working and in tune. So we know that in terms of stress, resilience to stress, coping behavior, etc., these mycobacteria have a terrific effect on inflammation generally, but in particular in the brain. And what affects the brain affects the gut. It's a full cycle. We've only realized this in the last couple of years. So the whole point about IMI, why we like it is, listen, you can try and it helps in the short term, but we're pretty confident that you need long-term control of your chronic inflammatory process. And here we have an example of these early onset colorectal cancers. We have evidence of lifespan effects in aging, which affect your health. and diseases of getting old too quickly. There are many things that make you get old too quickly, but one of the very important one, for example, is HIV/AIDS.
Mm.
People who have, in the old days, particularly of HIV/AIDS before treatment was available, they aged in front of your eyes.
Wow.
They got old cells very, very quickly. And
Mm.
so, this is why you need to pay attention. You need to buy a ticket in the lottery of life.
Yes.
Look after yourself. There's no magic bullet. Even IMI is not a magic bullet. You've got to do all those other things that we keep talking about. But the key factor is to make sure that you let them work together. And IMI has that important effect in our view. And we have
That's
some science.
fascinating. Well, once again, a great session of conversations with you, Dr. Charles. And, if you've watched these previously, hopefully you're getting an appreciation for how complicated our bodies are made, but how simple certain things are, that if we'll fix some of these pieces, there's no magic bullet, but there is a golden capsule that we talk about that reintroduces that healthy bacteria back into our bodies that, frankly, you and I have talked many times. I'm a baby boomer myself. I didn't know a person who had a peanut allergy or had asthma or any of the other common conditions. And now we've talked today about the incidence of cancer among younger populations. Not a great trend, and one that we need to make sure that we're doing everything we can epigenetically to take care of that. So hopefully, if you've watched this today, you've enjoyed this again. If it's the first time that you've watched one of these, be sure to hit the subscribe button below. And be sure also, if you want more information about IMI, be sure to go to immy.co. That's IMMY.co. And you'll get more information about the product, the science, the background, all the information you need. So be sure to tune in again. Dr. Charles, thank you so much. We'll do this again and look forward to seeing you then.
Thank you very much, Pat. I hope the guys enjoyed it.